Hi, I'm Dr. Duke, and this is Run Smart New York, your turbocharged sports medicine approach to preventing running injuries. Today, we have Lottie, a local runner and expert foodie. You gotta check out her Instagram. It's called Running on Veggies. So, when I first met Lottie, we were working out some of her issues with some of her injuries. I said, all right, show me how you stretch out your piriformis. And she was like, what are you talking about? And then that's when I said to myself, you know what, look, if you're an athlete and you're placing demands on your body, as athletes do, then you need to take some responsibility and get familiar with the anatomy of your body, because you have to support that body if you want to continue to run. So I explained what the piriformis is to her, and I'm going to explain it to you. Just turn a little sideways. So the piriformis attaches deep in the glutes, all the way deep. It attaches your sacrum, which is the bottom part of your spine, and it attaches it to your outer hip. Now the piriformis, when it gets short and tight, it'll kind of turn your hip out, almost like if you're walking like a duck foot. And then the sciatic nerve traverses very close to that piriformis muscle. It reaps havoc on runners because it can cause pseudo-sciatica. It'll cause possibly a stress fracture into the hip socket. It'll definitely jam up and lock up the SI joint. It'll cause the hip to drop. So anyway, we have to really learn how to stretch out this muscle. It's very important. So Lottie, show me how most people stretch out their piriformis, because it's very similar to a pose in yoga called pigeon pose.
So normally you just bring your leg up and just go like that, stretch it.
All right, now check out the angle of her knee. See how kind of narrow that angle is? Do you feel much of a stretch with this going on?
Not really, more like the back of my other leg.
Back of her other leg. Okay, yeah. That's like nowhere near the piriformis. That's the other leg. Now show them how I told you to stretch out the piriformis.
So first I'm going to bring my foot all the way up, my knee down there.
Nice.
My leg back.
Perfect.
And then I bring my elbows down there, and then I bend my other leg.
All right, now do me a favor. Show everyone where you feel it. Just point to it.
Right, all over here.
That is the area. And with the wider angle, you get a little bit of your IT band. If you feel a little tension in your knee, get out of the stretch because you're not on it. All right, I'm Dr. Duke, and this is Run Smart New York.